Hey guys, this is Dr. Ravi Kale from Maharashtra. I've done my MBBS from Smolensk Medical University, Russia, and I've cleared FMGE exam with a score of 195 in 2021 December session. And this was my first attempt. Over to you, Doctor.
Hi everyone, my name is Gemi Anitha. I'm from Tamil Nadu and I completed my MBBS from New Vision University, Georgia, and I cracked my June 2021 FMGE with a score of 270. And today we are here to play the knowledge fight by PrepLadder, which is kind of a rapid fire round where each one of us will get around 30 seconds to answer a question. Totally, we have around 10 questions, 5 questions to each one of us. And towards the end, the one with the highest score wins the game. Let's see how it goes. And I'm also excited like you. I hope you find this session interesting as well as useful because you get to revise along with us. Let's begin. Dr. Ravi, are you ready?
Yes, I'm totally ready.
Okay. Okay. Should I start you or you're starting?
Okay, I'll give you the first question.
I'll start.
Okay, fine. You start.
Okay, fine. The first question I have is from ENT. Okay. A patient presents to you with diaphoresis, increased pulse rate, tinnitus, and episodes of vertigo, which last for minutes to hours. Which is the most probable diagnosis? Do you want me to repeat the question?
No. I got the main points.
Okay. Option A is BPPV. Option B is labyrinthitis. Option C is Meniere's disease. And option D is vestibular neuritis. And your time starts now.
So, lasting for minutes to hours, right? And 10 minutes
yeah.
is present. That is nonsense. BPP is for a few seconds. It won't last for minutes. I'll go with Meniere's disease for sure.
Are you sure?
Yes, I'm sure.
You have 10 more seconds. Are you sure?
Yes, I'm pretty sure.
Okay. And option C is the right answer. You're correct.
Yes.
You've got 1 point. Let's see how it goes.
Let's see how it goes.
You can ask me the first question.
Yes, I'm asking the first question. Okay. So, what will you suspect in a newborn with lethargy, fused labia majora, and decreased blood glucose? Okay. So, I'll give you the options.
Okay. Lethargy, fused labia majora, and decreased blood sugar levels.
Yes. So, your options are A, Turner's, B, congenital adrenal hyperplasia, C, hypothyroidism, or is it D, Klinefelter syndrome? And your time starts now.
D is Klinefelter.
Klinefelter syndrome, yes, sir.
D is Klinefelter. Fused labia majora, decreased blood sugar, and lethargy, hypo. I'll go with congenital adrenal hyperplasia.
Are you sure?
Yeah, because along with fused labia majora, she also has decreased blood sugar levels. Yeah, I'm sure.
Okay, doctor, you got this point.
Congenital adrenal hyperplasia.
You are definitely right.
Okay.
Yeah.
Okay.
I'm ready for the next question.
Okay. I'm going to ask you this question from gynecology.
Okay. Sure.
From gynac, okay? A patient was using IUCD, intrauterine copper device, and after 2 months of usage, she presents with repeated attacks of syncope. What is the most likely cause? A patient was using IUCD. After 2 months of usage, she presents with repeated attacks of syncope. What is the most likely cause? Option A is ectopic pregnancy. Option B is abortion. Option C is sepsis. And option D is coagulation abnormality. And your time starts now.
Just syncope, right? You're telling me just syncopes. No any other finding.
Yeah, repeated attacks of syncope.
IUCD, it should be ectopic pregnancy. Abortion?
Are you sure?
Yes, I'm going with ectopic pregnancy. I'm going with ectopic pregnancies.
And you're right.
Yes.
It is ectopic pregnancy.
Thank you.
Okay, you've got 2 points. I'm waiting for my next question.
So, the next question for you is from anatomy. All branches of the femoral artery.
Okay.
So, all branches of the femoral artery are given in femoral triangle, except Okay. A, descending genicular artery. B, superficial epigastric artery. C, superficial circumflex artery. Or is it D, external pudendal artery? Should I repeat the options for you?
All branches.
Yes, all branches
Yeah,
of the
I can
femoral
repeat
artery
once.
are given in the femoral triangle, except. So, which of the following of them is not going from the femoral triangle?
Except, okay,
Except.
understood.
The time starts already started.
Okay. So all of the branches of femoral artery given in femoral triangle, except, I guess it has to be, I'm not sure, but I guess it is descending genicular artery.
You are right, doctor. You get this point.
Oh, okay.
Yes.
It was a guess. I also have a question for you from anatomy.
I'm ready.
Are you ready?
Yes, I'm ready.
Okay. Middle rectal artery is a branch of which of the following arteries?
Okay.
Middle rectal artery is a branch of which of the following arteries? Option A is internal iliac artery. Option B is abdominal aorta. Option C is obturator artery. And option D is external iliac artery. And your time starts now.
What was the option B?
Option B is abdominal aorta.
I'll go with internal iliac artery.
Are you sure?
Yes, I'm sure.
Can we lock the option?
Yes, we should lock the option.
And you're correct. It is internal iliac artery.
So it's
congratulations. You've got 3 points, and I've got 2 points. Let's see how it goes. Yes. You have to ask me the third question.
So I'm asking the third question now. And so this PITHO trial, I'll spell it PIETHO. PITHO trial is for which of the following? Okay. The options are option A, breast cancer, option B, lung cancer, option C, pulmonary embolism, or is it option D, rheumatic fever? PITHO trial. And your time starts now.
I seriously have no idea because I haven't heard of this name, PITHO trial. I'm just gonna make a guess here. Since you've given me 2 cancer options, okay, I'll go with lung cancer.
Are you sure?
Not at all sure. Let's see if it turns out to be right.
It's pulmonary embolism, doctor. You're wrong. If you remember the treasure thing, no, then PITHO trial. Yes, PITHO trial. It's pulmonary embolism, option C. Okay. I'm ready for the next question. Okay, the fourth question for you is Adlet's criteria is used for which of the following diseases? One line now. Adlet's criteria is used for which of the following diseases? Option A is meningitis, option B is Wilson's, option C is tetanus, and option D is rabies. No, I'm clueless. And your time starts now. I seriously don't have any idea of this. Adlet's criteria. I'll go with option D, rabies. Are you sure? Yes, I'm not sure, but I'll go with it because I have no idea right now. So, okay. Tell me it's right. You have time. No, I'll go with the rabies. Option D. Okay. Option D. And the correct option is option C, tetanus. It's not rabies. So Adlet's criteria is used for tetanus, not for rabies. So you've got 3 points, and I've also got 3 points. So I'll ask you another question. Next question for you is from. You're going to ask me the fourth question? Or? Yes, I'm asking you the fourth question now. So this is from pharmacology. Which of the following is the longest acting but the most toxic local anesthetic? Which of the following is the longest acting but most toxic local anesthetic? And options are option A, lignocaine, B, cocaine, 3, chlorprocaine, or is it D, dibucaine? Should I repeat the options for you? Your time has started.
Okay. You can just read out the question again.
Which of the following is the longest acting
Longest acting?
but most toxic local anesthetic?
Okay. Longest acting. I'll go with option D.
Are you sure?
Yeah.
That's you get this point. It is correct option.
Okay. So I've got 4 points now.
4 points. Yes, you got 4 points, and I'm on 3 right now.
No, I've got 3 points.
Yes, you
because
got
that pulmonary embolism 3 to 12. Yeah, 3 on 3.
3 on 3.
So, yeah, I'm gonna ask you the final question now. Your final question, and then you'll ask me my final question. Okay. So this one is from histology. Let's see how your basics are. What are the cell types of adenohypophysis which are eosinophilic? I repeat, what are the cell types of adenohypophysis which are eosinophilic? Option A is somatotropes and lactotropes. Option B is thyrotropes and somatotropes. Option C is corticotropes and lactotropes. And option D is thyrotropes and gonadotropes. I've got you confused options. So I'll read out the options again and then I'll set the time. Option A is somatotropes. And okay, you want me to repeat or shall I start the timer?
Yes, I want you to repeat the options.
Okay, option A is somatotropes and lactotropes. Option B is thyrotropes and somatotropes. Option C is corticotropes and lactotropes. And option D is thyrotropes and gonadotropes. And your time starts now.
Somatotropes, I just remember somatotropes, but pretty sure about the another one.
Got 10 more seconds.
It's very confusing. I'll go with option B, thyrotropes and somatotropes.
Option B is the wrong one because option A is right, somatotropes and lactotropes.
The somatotropes were there. I was just able to recall the somatotrope thing, and the other one I wasn't able to. You should give me a point for this question, because I am right with one.
Half.
Okay,
I'll give you half. It's okay because somatotrope was right, but the other option, thyrotrope, is wrong. So option A, somatotropes and lactotropes, is the right option. So I'll give you half. Fine.
Thank you.
So you have 3.5 now.
Yes. And okay.
3.5. And yeah, this question is going to decide who's going to win this game because I have got 3 points, and let's see if I score this.
So, okay, the last question for you, the 5th question is CCFA agar is used for which of the following? CCFA agar is used for which of the following? Hemophilus influenzae. Hemophilus influenzae, option A. Option B, C. difficile, Clostridium difficile. Option C, Neisseria meningitis. Option D, Pseudomonas.
Option B, Clostridium difficile.
You're right. This was so quick.
Luckily, I knew this answer.
Okay.
Yeah.
So you have 4 points as of now, and I'm yet to get my last question to be asked.
No.
No.
You have 3.5 and I've got 4. So, yeah.
So here I am with the 5th question to you, Doctor, the last question.
The final question, which is going to decide who is going to win this game. Yeah.
CCFA agar.
I hope it's easy.
CCFA agar is used for which of the following? A. Hemophilus influenzae. B. Clostridium difficile. C. Neisseria meningitis.
I know this. I know this answer. It's Clostridium difficile.
That was so quick, Doctor. You're right. You get this.
It was an easy question. That's right.
Yeah.
I got it.
I thought pharmacology will make
so you. So I've got 3.5.
Yes. And
I've got 4.
So we have a clear winner over here, guys, and it's Dr. Gemi.
Not a clear winner. It's just a matter of 0.5 points.
5, I think, but it's okay. I made it wrong.
Yeah.
In exam, you don't get no half mark if you get the answer. So we have the winner over here, Dr. Gemi. Congratulations. And it was really fun.
Thank you.
I was damn excited when we got this. We got to know that we are going to shoot this kind of video and this kind of activity which PrepLadder is going to get for us. So this is really nice, and like from start we started.
I hope all of them also revised along with us.
Yes, I hope you guys are.
Right. It would have been a revision session. Okay. Thank you.
Thank you. Thank you.